Medicare is the federal health insurance program, mainly for people 65 and older. Here are the 4 parts, simply.
I'm Maya. Medicare comes in 4 parts: A, B, C, and D. Once you know what each covers, it gets a lot less confusing.
Part A covers inpatient hospital stays, skilled nursing, hospice, and some home health. Most people pay no premium for Part A, if they or a spouse paid Medicare taxes for at least 10 years. Part B covers doctor visits, outpatient care, and preventative services. It's optional, with a monthly premium. In 2026, the standard premium is $202.90.
For 2026, the standard Part B premium is $202.90, and the annual deductible is $283. After the deductible, you typically pay 20% coinsurance.
Maria enrolls in Part B in 2026. The Medicare-approved amount for a doctor visit is $200. After her $283 deductible, her 20% coinsurance is 20% of $200, which is $40. That $40 comes from 20% of the $200 Medicare-approved amount. Part C is offered by private insurers and bundles Parts A and B, usually D too. Some have $0 premiums, though you still pay the Part B premium. They often add vision, dental, and hearing. Part D covers prescription drugs, sold by private insurers with a separate premium. In 2026, no plan's deductible may exceed $615, and some have none. In 2026, the Part A inpatient deductible is $1,736 per benefit period. Skilled nursing facility days 21 to 100 cost $217 per day. Skip Part B or D when first eligible, and you face a permanent late enrollment penalty, 10% of the premium for each full year you delayed. Sign up on time.
Quick recap. Medicare, simply,
Part A is hospital, Part B is medical. Both have deductibles and 20% coinsurance with no annual out-of-pocket cap.
Part C bundles it together through a private insurer. Part D covers prescriptions. Don't skip B or D or you'll pay a penalty.
I'm Maya. If this helped, hit subscribe, and I'll see you in the next one. Let's make insurance simple.